Welcome back. We have that interview with ABC7's medical contributor, Dr. Neha Sharma, and the chair of neurosurgery at the Mayo Clinic, Dr. Bernard Bendock. They're discussing awake brain surgery.
This is such a fascinating development. Dr. Bendock, can you please tell us what exactly is awake brain surgery?
Well, first of all, I'd like to say that even though we call it awake brain surgery, it's actually asleep, awake, asleep in reality, because we make sure to block all the nerves in the scalp that can eliminate pain, and the patient is typically put to sleep for the incision and the exposure with sedation. And then during that delicate part of the procedure where we're trying to map the brain to give the best possible outcome to the patient that integrates what we know about that patient's humanity, whether they're a piano player, an opera singer, a talk show host, we want to make sure that we integrate that into our plan. And so we typically have a neurologist in the room sitting with the patient, examining the patient during that part of the operation. And interestingly, that part of the operation doesn't typically hurt because the brain, stimulating the brain is not a painful thing to happen. And so it gives us a lot of great information that allows us to tailor the operation to that patient's needs, and it incorporates the most important elements of that patient's life into the operation.
That is great. And who is an ideal candidate for the surgery, and what are the indications?
You know, anytime we're thinking about an operation that involves delicate tissue that has to be removed or stimulated that is near critical areas of the brain, that would be a good indication to at least think about this operation. Obviously, it takes a motivated patient, and the way we tackle that motivation is, you know, when patients first hear that we're recommending the operation be done awake, the first reaction is obviously always fear, even if the patient is a doctor. But when you take that fear and you educate the patient by letting them know that you care about what's most important to them and preserving that function, all of a sudden that fear becomes motivation, and that patient becomes an active participant in their care rather than just a passive recipient of the care. And that makes all the difference. And so I had an opera singer once, for example, who told me, if I wake up paralyzed, it wouldn't be the end of the world, but if I cannot sing opera, my life is over. So it became the whole focus of the operation to not only treat her AVM, but to actually map out her singing abilities relative to that AVM and to factor that into the operation. So we actually had her sing during the operation, and she was singing as soon as she woke up from the operation, which at the end of the day was what she wanted and what we had to deliver.
Right. And the recovery process, is it the same as a conventional procedure for the patients, or is there anything different?
Well, you know, Dr. Sharma, that's a great question. Interestingly, when people are not put under general anesthesia, the recovery can be faster. And for the right patient, if it's indicated and it's the right thing to do, the beautiful thing about being awake during this part of the procedure is that we have a neurological exam as soon as they wake up, and they can often go home either later that day or the next morning. Whereas sometimes when people are put to sleep, the drugs that are needed to put somebody to sleep can sometimes result in their recovery being a little bit slower. And so when it's the right thing to do, an added benefit is can be a faster recovery.
It is such an intriguing concept. And I want to ask you, can you tell us if this concept will ever expand beyond the brain?
You know, interestingly, in many areas of healthcare, people have been moving to regional anesthesia rather than putting a patient completely to sleep. For example, in orthopedics, it has become much more common to do a regional block, to block the nerves to the leg, let's say, so the patient has no pain. And we're seeing this in many other areas. Even some areas of cardiac surgery, believe it or not, people are starting to understand and probe this area. So there are some advantages, there are some disadvantages, but with modern pharmacology and the modern drugs, we can move away from general anesthesia in some cases. Again, not for everyone, not for every operation, but for select operations, it could be the better way to go.
Thank you so much for your time, Dr. Bendock.
Absolutely, my pleasure.